Imagine, just imagine, a loved one comes down with a cold that quickly worsens and leaves them paralyzed and struggling to breathe. You're desperate for answers, but doctors and health officials can't pinpoint an effective treatment or even tell you what's causing it. Today, outraged moms across America are demanding answers for the hundreds of kids who are fighting a polio-like illness that's leaving some paralyzed and fighting for their lives. Cases of this mysterious virus have been surging, and families fear that time is running out. They're asking the question, how many more kids need to suffer before we find out what's really going on? Could you be at risk for this potentially deadly illness attacking your family?
Luke went from having common cold symptoms to being paralyzed from the neck down within 48 hours.
My son Chris is 18 years old. He was a normal high school senior having fun with his friends, and then in a couple of days, he was on a ventilator and couldn't breathe.
It's a mysterious illness that's blindsided the medical community and ravaged the lives of its victims, 90% of them children. AFM, acute flaccid myelitis, is a serious neurological disease that affects the spinal cord and almost overnight causes the muscles and reflexes in the body to suddenly become weak. Or as one mom tells us, it's as if the body is melting.
For the kids especially, it's been so heartbreaking.
Since 2014, there have been reports of fevers followed by symptoms like slurred speech, trouble moving eyes, or even breathing.
I never in a million years thought that this would affect my family, but it did.
The CDC is now investigating, but it's clear from a sobering online statement that America's top doctors are still very much in the dark.
It's as if no one in the medical field could tell us what she had, how she got it, or how to treat it. In fact, she was misdiagnosed 3 times.
If they had recognized the symptoms sooner, we might not have had 2 respiratory failures.
No one can tell us if Luke will ever be able to walk again.
Parents who've watched helplessly as their children have been swiftly overwhelmed by this horrifying polio-like illness are outraged. Some have even accused the CDC of hiding 2 AFM deaths and are angry more has not been done.
It's so frustrating because it just seems as if from onset to diagnosis to treatment, it was a hit or miss situation.
The clock is ticking. Case numbers hit an all-time high in 2018 and are predicted to climb again next year. Today, what you need to know and how you can protect your family from this dreadful illness.
It can happen to anyone. It can happen to you.
I've invited parents all across America to join us. And what's been so frightening about this mysterious illness is that it starts with a fever or a cough, but can quickly progress into a medical emergency. And it has parents all around the country worrying every time their kid catches a cold. Let me start with Katie. Her son Alex went from this to this in less than 48 hours. He ultimately lost his battle with this mysterious condition. And Heather, whose son Hayden is paralyzed after coming down with this illness. I want to thank you both for being with me. I know this is difficult to revisit. Let's start with your son. When did you first realize that something wasn't right with your child?
It was Christmas Eve, and he had come running in like a normal 5-year-old. He was very excited. We were having the family over. My husband, my older son, went out to run errands, so I gave Alex some yogurt to eat while I was cleaning and getting ready. And I said, why aren't you eating your yogurt? And he said, Mom, I can't move my thumb. So we had all had a cold that month. I thought maybe he was dehydrated. I had him drink some water. 30 minutes later, I checked on him again, and I kind of did a test on him, and he really couldn't move it. So I called the advice nurse, and she said, you need to get to the emergency room now.
So Katie, you do that, right? You're sent to the ER, you run over there. How quickly did his condition worsen?
So by the time I got dressed and got his shoes on, he was clearly just looked sick. He did not feel good. I was helping him get in the car. As we're driving to the hospital, he said, Mommy, I can't open my eyes. I looked back and they were open, but he was visibly just weakening. So I pulled over and I called 911. 911 took him to the hospital, And they did a series of tests. We got to the hospital around 11. We were there all afternoon, all evening, and I just watched him melt. By the time he was admitted at 9 o'clock, he could barely stand, he could barely use his neck, and he could not move his left arm at all, and he could only use his right forearm.
So within 12 hours, he went from saying my thumb doesn't work quite right to not being able to move most of his muscles.
Right. And then the next day, I noticed his cough had weakened, so they moved him to the ICU. And
Cough weakened because he was unable to cough?
he was unable to cough. His diaphragm was weakening. That lasted about a week, and it wasn't getting better. So then they had to put in the trach. And he never breathed on his own again.
I'm so sorry.
Thank you.
There's currently no effective treatment. Katie's son, Alex, passed away after months of tests and surgeries and efforts to try to help him. I can't even begin to comfort you. It breaks my heart just to hear these stories, and there's so many now that are coming out. Why was it important for you to be here, to go through the pain of sharing your story?
Throughout his diagnosis, throughout the therapy and all of that, even though I had joined the Facebook group, I felt very alone. I didn't realize how widely this was affecting the country. And I would never want another family to go through what we went through. It was horrifying. I would not wish that on anyone.
Well, I want to thank you for speaking out. Heather, let me bring you into this. Your son, Hayden, he's been battling this illness for how many years?
4 years.
For 4 years. And there's no word yet on how best to treat him. So how did it all start with him?
Hayden, in October of 2014, it was about the third week of school, and he got the cold that half the school had. And so he was sick over the weekend, and I kept him home from a couple of days of school just to make sure he was really on the mend. And he was fine. He went to school for 2 days, and he came home and said that his neck was sore. And 2 days later, on a Sunday morning, we woke up, and Hayden's neck no longer supported his head. His head was all the way back like a newborn's would be if you didn't support it. And over the next 24 hours, we started watching the paralysis zigzag from his neck. It went down one side of his diaphragm and the other side of his diaphragm. And at that point, he was transferred to the ICU. He was intubated. And within a few days, he was completely paralyzed to his toes and getting sicker.
How's he doing now?
He is really thriving. We don't have the recovery that some kids seem to get. I keep waiting for it to snowball, and one improvement means it all will improve. So he's still affected neck down. We have done a couple of surgeries that allow him to breathe on his own for about 6 hours a day with a diaphragmatic pacer. But 4 years out, we're really now about balancing having a life and recovery. So he still does PT 3 days a week, but he's in college full-time a full year early because he just wanted to move on with his life, and so that's what we're doing.
So I'm amazed at how fast the disease progresses when the children get it. Obviously, it leaves sometimes long-term problems that are surmountable, but you wish you didn't have, and sometimes it can be lethal. The CDC has called this mysterious illness AFM. And when you guys visited in November, I believe it was, to get answers, what did they tell you was going on? What hope did they offer you?
They offered the hope that we have scientists that are looking into this to give us some answers. They were very willing to hear our stories and to work with a group of doctors and to take our stories into account, that we can get some research and get some more answers. And once they do that, there's medical personnel or researchers across the country that are willing to look into this. We needed some answers from the CDC as to what they thought the causation was. And since we think it's a virus, it was important for them to admit that we thought it was a viral cause. And they did, after that meeting, come out and say that the vast majority of cases, our kids had a cold. And then it went from there. But like Katie, I am very much about, I don't want another family to go through this for both their child or for both their parents, because this is devastating for the whole family, not just the individual child or mom or dad. It affects everyone.
Thank you for speaking out. Thanks for going to Washington. Thanks for pushing for more answers for an illness that we've tolerated longer than we should have. We'll be right back. Patients demanding answers, and we'll have some. We've been talking to parents all across the country who've been dealing with a mysterious illness that starts off as a cold and can quickly progress to paralysis. Many families affected by AFM say they've been trying to get answers for months. They say they feel frustrated by the lack of a diagnosis or a treatment protocol. And I want to thank you all for taking time and reliving some of this, the pain, to tell us your stories. Krista joins us now via Zoom. Her son came down with this virus in 2016 and is paralyzed from the neck down. Krista, it took many months, and I understand 2 different hospitals, to find a doctor who would even diagnose this. What was that like for you and your family?
It was actually the 3rd hospital that diagnosed him, unfortunately. He was misdiagnosed for a good long time. Initially, he had a cold like what everyone else had. And his hand started being weak at the grocery store one day. So we rushed him to the emergency room, where he stayed for 7 hours without even being checked by a doctor. They said that he must just be tired. During that time, the paralysis gradually spread until my husband removed him to another hospital, where he finally got care. But even there, he was misdiagnosed. Within 48, 72 hours, he was paralyzed neck down, and he was beginning to struggle to breathe. So for us, not knowing right away an accurate diagnosis really delayed the treatment that he needed to get better.
You say you feel frustrated and abandoned by health officials who you say aren't acknowledging the severity or the scope of this problem.
Yeah, I'd say you go into the hospital and you think that somebody, they know, it's their job to know what's wrong with your child. They're there to help. But for my husband and I, most of the information that we've gotten, we've had to find that out ourselves. And some of the doctors that we speak to that work with AFM children think that the numbers are actually 10 times what the CDC is currently claiming, because of misdiagnosis and because there's no mandatory reporting from the hospitals. If hospitals had to report all the cases they see, then we could get an accurate picture of how widespread this really is.
How is your son doing now?
Initially, he was paralyzed neck down, but now he's starting to use a walker in therapy. We're hoping that eventually he'll progress to being able to use it more in the community. So, but it's been a long, long road to get there, and we're seeing other kids, they don't get that intensive therapy because the insurance companies or the doctors don't see the need, and so they think this is what the kids get, and then they never progress.
Well, thank you for sharing your story with us, and I wish you the best. And I tell you, I know how much time and effort it takes to get that kind of rehab, but it does pay off. As of today's taping, the CDC has officially reported more than 500 cases of AFM. The big question, you just heard it, how many undiagnosed cases could there be out there? It sounds like there are far too many questions and not enough answers. So when we come back, the latest on the virus that could be causing this mysterious illness. Could there be a potential break in this case? And we investigate, what is the CDC doing to stop this from happening to more kids?
Our son Carter was diagnosed with AFM at the age of 3.5. He died this past September. He was really severely affected. He lost his ability to breathe, eat, swallow, and move everything at an age where most toddlers are defined by their physical abilities. While I'm glad for the 2.5 years our family had with Carter, I don't just believe or think that he would still be here if it wasn't for AFM. I know he would.
America's moms and doctors around the country are demanding answers about a mysterious virus called AFM that's leaving kids paralyzed and fighting for their lives. Principal Deputy Director Dr. Ann Schuckett from the CDC joins us. Dr. Schuckett, we've just heard the anguish, the pain, and even anger of parents right now. There seems to be a lot of questions and not a lot of answers. So what is the latest in the investigation into this disease?
Well, as you know, this is just a heartbreaking condition for so many families who've suddenly seen their children have very critical illnesses. What I can say is that right now, new reports are quite low. It looks like, as in previous years, the increase in cases occurs around August through October and November. So we're out of the woods, it appears, for this season, but we're taking this very seriously.
So it's been about 4 years since the first reports of this virus, and hundreds of kids have gotten sick. Have there been any leads, things that you think could help us understand what is causing this?
We think the vast majority of cases occur following viral-like illness, a fever, sometimes a respiratory syndrome, occasionally a diarrheal type syndrome. And so there's good suggestion that there's a virus triggering the condition.
Your best guess on when you think the CDC will be able to give us some answers on what is causing this illness, how to treat it? Are we months away, years away? What's your time frame?
It's so frustrating for parents to not have the answers that they need. We're working very hard on this right now. I can't promise we'll know everything we need to know in the next few months. We're working very hard on this, trying to learn from the past and get ready for the summer and fall when more cases can occur.
For anyone who's watching the show right now, is there a way to reduce the chance of getting this or prevent it?
You know, we don't know the full causes. We don't know why we have millions of people getting enteroviruses, for instance, and other respiratory viral infections each year, and dozens or hundreds getting this AFM in alternate years. So I don't have a good way to prevent it, but I can say parents should look for the early signs and take them seriously and get prompt medical care for their children if they're developing weakness in an arm or leg.
Thank you for your efforts, Dr. Schuchat. I know a lot of you at home want answers, so let me bring in an infectious disease expert who's been working around the clock on this case, Dr. Ian Lipkin, Director of the Center for Infection and Immunity at Columbia University. Thank you for being here. So if I can brag on one of my colleagues from Columbia for a second, he's known as the virus hunter. People from all over the world call you because you just seem to be able to figure these riddles out, and they're more than we know, but this is a particularly bad riddle to have to solve. How does a virus like this exist? Does it suddenly pop up and start to devastate us, or was it always there, we just never noticed it before?
There are a couple of possibilities. One is that the virus was elsewhere in the world, and now we're beginning to see it in North America. Another possibility is that it truly is a new virus that has evolved in some way to cause this new disease.
And again, as someone who's a real top-notch expert in this area, you do think it's a virus and not something else causing this condition?
I'd say we're confident at this point in the community that it is a virus.
So what do we need to do as a nation to be able to crack this case, to understand if it's a new virus or some old virus doing something new to us?
So until we know the cause, it's going to be very difficult to come up with either a prevention or a cure.
Are we months or years away?
I'm optimistic that we're months away from identifying the cause.
Would you join me with some parents?
Sure, of course.
They want direct access to you. It's rare to have someone who knows as much as anyone else does on the planet about a condition with parents who are suffering with children. So I know you all have questions. Mikkel, we're going to start with you.
In 2014, my daughter Bailey was very sick with a respiratory infection, and she was in the hospital for a long time. And the question we were asked a lot is she contagious, and will she make other children sick?
I think it's an excellent question. These viruses typically are very infectious. Fortunately, not everyone who becomes infected with this virus has this particular outcome. We don't know, because we don't know the cause, whether or not there's some sort of genetic susceptibility or simply very, very bad misfortune that means some children progress from the respiratory ailment to AFM. And I'm very, very sorry to hear this. It's all of you. We really do feel terribly for you, because we've seen these children.
We appreciate everything you're doing to help us find answers, that's for sure.
So we're going to put some more of the questions and answers online. I'm not going to stop talking about this until we know what's causing the epidemic or how to treat it. We got to be better prepared. So thank you very much for being here. We'll be right back.